Okay, so first of all, I want to just give a little introduction to our guest, who is an incredible resource to our hospital. So Dr. Elena Ivanina is one of our colleagues who we've been working with for years now, because she essentially has tremendous expertise that overlaps with cardiology and cardiovascular health. She is board certified in public health, preventative health, and gastroenterology. She's an expert in plant-based diets and healthy eating. And she is also the director of neurointegrative gastroenterology at Lenox Hill Hospital. So we're really excited today. We've had her speak before. Everyone knows what a great speaker she is. And so today she's going to talk about the gut-heart connection. So we're very excited, and you can just let me know when you need me to advance your slides.
Thank you. Thank you, Dr. Gianos, for having me and inviting me. I really appreciate it and love having the opportunity to talk about this and the ways that our two fields are connected. So let's get started. So, heart attack with extra cheese, heart attack with bacon, double bypass, no pickles. Hey, where's my diabetes and large stroke, right? That's what we're eating these days. So I'm going to start pretty basic because I think the microbiome is pretty complicated. So let's kind of just understand, what is the microbiome, right? The microbiome are trillions of organisms that live in your gut. And this is not just bacterial, though that's what you usually hear about, but it also includes viruses and fungi. And they actually encode genes, right? They help turn genes on and off and basically help our whole body understand how to function. And they produce thousands of metabolites, which all have different properties and different functions in our body. Next. So we know kind of this general normal, abnormal. And again, the microbiome is very much in the infancy of research. So we're just beginning to understand what is normal, what is not normal. And everyone's microbiome is very unique, and that we do understand. But normal, seems to be people who have a high Bacteroidetes to Firmicutes ratio, and it's very diverse. A lot of different bugs, and a lot of them, and a lot of diversity in the type. And in twin studies, they've actually found that environmental factors, so diet and drugs, are even larger determinants of the microbiome than genes, which is huge, right? What we eat and what we put in our guts is even more important than the genes that we were born with. So, but then we do know, right, there's normal, and then what's abnormal? Well, you don't have the good bacteria, there's overgrowth of bad bacteria, and you don't have that diversity. Okay. So, and what does this microbiome do? It's actually really like the newest organ because it does so much. It's so complicated. You can see on top on the right, you have the microbiota and it's called the milieu. So what's there in the middle with all those bugs, that's kind of the inside of your gut, right? That's where you put your food. That's where the bugs are, and they sit there, and they basically have direct antibacterial and antiviral effects, and they even modulate metabolism. We'll talk about how in a minute. And then you have the gut barrier, which again, you see the bugs there in the middle, and then the barrier separates what's inside the actual gut, the food and those microbiome bugs, from what's in the actual wall, right? And so again, this gut barrier is really, really, really important. There's a mucus layer. You have these tight junctions that keep what's in the lumen from getting into the wall, because where in the wall is where your immune system is, and that's where your blood cells are to actually take things and bring them to the rest of your body. So again, when you're starting to think of, well, how can the microbiome have any connection to the heart? Well, here it is. So you have this connection to blood vessels and directly being able to move things, throughout the system. And so again, and then you have your immune system there, also very important. And your gut's immune system is the IgA antibody specifically. Okay. And so this is just a very busy slide because it shows you that the microbiome is is involved in so much. And on the left in red, you see disease, right? And we're going to talk about a couple of these things: decreased short chain fatty acid production, increased TMAO production, increased cardiovascular risk, inflammation, cognitive decline, insulin resistance. And on the right, you see, okay, it's also it can be really beneficial. A lot of kind of the opposites, right? Increased short chain fatty acids, low gut inflammation, improved lipid metabolism, insulin sensitivity. So it is involved in a lot of things, and you can start seeing the crossover between heart health and gut health here. Okay. So again, how can your gut microbiome actually affect your heart? What is the connection? Okay, next. So the microbiome can communicate with distant organs like the heart with signaling molecules. This is what I talked about before. So there are actual structural components of the microbiome, and especially if you have an impaired gut wall barrier, they will cross into the blood, the circulation, and get to the heart and everywhere else. And then in addition, you have the bioactive products that are made by those bugs: short chain fatty acids, bile acids, and TMAO. We'll talk about them now. So short chain fatty acids, you might have seen this at your, health food store in your neighborhood. They're trying to sell this to you now, like butyric acid. So the big ones are butyrate, propionate, acetate. And so only certain bacteria make these, and they are anti-inflammatory, anti-cancer, antibacterial. So these are actually, this is what fiber is broken down into. And this is the food then for the health of your gut cells. So this is so important in that gut barrier: immunity, glucose control, metabolism, appetite control, weight gain. So many things are woven into short chain fatty acids. Okay, next. And then bile acids are also incredibly important. So they're actually made in the liver, as you can see here on the left, and they are dumped into the small intestine, the duodenum, and then they're altered by the microbiome. The microbiome has the potential to change how they function. And so these bile acids help you break down, absorb, and metabolize nutrients. Again, glucose control, metabolism, and that really important gut barrier. And now that acronym I mentioned before, TMAO, so trimethylamine N-Oxide. So perhaps not something you've been familiar with in the past, but something that, hopefully you get very familiar with by the end of this talk. So TMAO comes from meat and dairy primarily, right? And the big things here are it's been shown to increase insulin resistance and increase cardiovascular events. So let's dig in a little deeper. So this was a really great paper in the New England Journal back in 2013 now, where you see here, so carnitine and choline, which are basically when you have meat and cheese and eggs, like I said, meat and dairy, basically they're broken down. They have a good amount of carnitine and choline. And so after you eat it, it is metabolized by your gut flora into trimethylamine. Then it goes to your liver, where it's further processed into TMAO. And then you can see there, it leads to atherosclerosis and plaques, right? Plaques in vessels, which, as we know, lead to stroke, heart attack, and death. So this was a great tweet from Dr. Williams, who I believe was the previous head of the American Heart Association. You can correct me if I'm wrong. And so he had written in this tweet, hasn't everyone heard about TMAO and stopped eating animals? Sorry to hear a friend's brother died today at 46, 1 month after 5 stents, didn't change his diet, new stents, needed dual antiplatelet therapy. And there's this study that showed that TMAO makes you clot as if no aspirin was taken. I mean, this is incredible. Like, talk about food being medicine. Okay. So again, carnitine I mentioned, that comes from animal products, meat, fish, poultry, milk. And it's the redder the meat, the higher the carnitine. So you can see on the bottom there, beefsteak, ground beef, really high. Cheddar cheese, okay, a lot less. And then choline, right? Again, animal products, meat, poultry, fish, dairy. And a lot of dietary choline comes in the form of phosphatidylcholine, which comes from processed food and especially emulsifiers. Lecithin is used as an emulsifier stabilizer. If you read like packaged, the packaged food labels, you'll see very commonly soy lecithin and different types of lecithin. Again, beef liver, if you look at the bottom, highest amount of choline there. Eggs, again, beef, are really top the charts there. Okay. And so this was a great study that looked at the impact of dietary red meat, white meat, or non-meat. And you can see there the take home in red is red meat, but not white meat actually. So not chicken or turkey or duck or no meat increased TMAO. And I always want to remind everyone that pork is red meat, even though they like to sell it as the other white meat. It's not, it's red. So, red meat is beef, it's lamb, it's pork. Those are really the big ones to remember. But white meat does not have the same effect on TMAO. Okay. And another, study showed that the gut microbiome metabolized, when it metabolized carnitine, it promoted atherosclerosis, right? And it specifically showed you eat more meat, it makes TMAO, and there's more atherosclerosis, right? It's like a dose-dependent relationship. The more you eat, more TMAO, more plaque in your vessels. And this was a big study, again, in the New England Journal, kind of our most prestigious journal, showing that high TMAO was associated with an increased risk of major cardiovascular events. So that's death, heart attack, and stroke over 3 years. And if you go to the next page, you can see the Kaplan-Meier curve where it shows you that in the highest quartile 4, so people who had the highest TMAO, on the left it shows MIs, which are heart attacks, strokes, and death. So you can see a clear delineation there. More TMAO, more heart attacks, strokes, and death. So we'll talk about a couple specific heart conditions, so atherosclerosis. So as we kind of mentioned before, there's these plaques in vessels that lead to heart disease, right, and heart attacks. And again, to tie in how the gut and the heart are connected, well, they've looked at these plaques and they've actually contained bacterial DNA that is the same as the gut microbiome. So there are these thoughts that maybe there's been some bacterial translocation from the GI tract or the oral cavity, and this could actually impact plaque stability and the development of cardiovascular disease. And the microbiome of heart disease patients may be producing more pro-inflammatory molecules, right? So the microbiome there were differences in stable versus unstable plaques. And so again, they found that in unstable plaques, there was less good bacteria, there was less anti-inflammatory molecules and more pro-inflammatory molecules, right? They're connected, right? The microbiome and what's going on with these plaques. So again, in heart attack, right, when you take the atherosclerosis to the next event, they found that there's a link between the gut microbiome and the severity of heart attacks. And this is in animal studies, and specific microbiota like Lactobacillus plantarum that reduce the heart attack size. Better heart function was seen afterwards, and Lactobacillus rhamnosus GR1, less structural heart changes and heart failure after heart attack. So again, these are really, they're associations, but they they start the conversation that there are connections with what's going on in the gut and, how you do after a heart attack and what happens structurally to your heart. So going next to heart failure for a minute. So there's actually this gut hypothesis of heart failure, which is again, it's a hypothesis, but it's fascinating. So that there's less outflow from the heart and less blood to the gut, higher gut inflammation, higher bacterial translocation, and this higher systemic inflammation. And TMAO levels have been linked to heart failure development. So more on the next slide. And I won't go into this too much, but again, in TMAO, as you see on the bottom, there was more heart enlargement, and they found that the heart couldn't pump blood as well. And there's even more water in lungs. So here's TMAO again, coming from microbiome breakdown of certain food that you're eating, and it's leading to these changes in your heart. So metabolic disease is, is everywhere. So I wanted to touch on a couple of the subcomponents of metabolic disease and how they are related. Okay. So first, cholesterol. So, there's been an association between microbiome and cholesterol, specifically triglycerides and HDL. And I think there's more and more, talk about how important, triglycerides and HDL are. Maybe some focus has been shifting from LDL to HDL and triglycerides, and I find really fascinating. I think, and Dr. Janos can talk to this more, but I think triglycerides are something that, probably food has one of the biggest impacts on changing as far as the cholesterol panel. And again, cholesterol metabolism is affected by those bile acids we talked about and TMAO. So the next component of metabolic syndrome and metabolic disease is obesity. And now here you see the ratio is increased firmicutes to bacteroidetes. And so if you remember from my beginning slide, it was the opposite, right? And then if you do weight loss or calorie restriction, then it goes back to being normal, right? Just with dietary changes. And, what's been shown is that in twin studies, when you have one who's obese on top and one who's lean on the bottom, right? And if you do a microbiome transplant into a mouse and you give that mouse a low fat but high fiber diet, they're going to become, they're going to gain weight just like the microbiome of that original person. But if you have a lean twin and you do the same thing, same exact diet, they're lean, right? So in this case, there's something in that microbiome that's being transplanted, because no matter the diet that they're getting, they are becoming, like the microbiome that was originally, either more increased in adiposity, which is increased in fat cells, or a lean type. Okay. And really fascinating is in bariatric surgery, they found that there are changes to the microbiome, such as increased bile acids. And so in a study, mice got a fecal transplant from a person after bariatric surgery, and then they gained less fat than mice who got fecal transplant from obese people. So again, something in that microbiome that we're able to transplant from one person or mouse to another, and it's dictating what is happening to the metabolism in the recipient. Insulin resistance, type 2 diabetes. Insulin resistance is, just absolutely everywhere, and there are books being written about it right and left. Dr. Lustig from UCSF, he's kind of my point person on who I really love to read his books about insulin resistance, and especially the epidemic in kids, which is really scary. But, this, again, there's a huge dietary component, and, Dr. Lustig just recently had a book about this and really talks about fructose as being one of the biggest parts of insulin resistance, one of the biggest food instigators of insulin resistance. So in this, they found that microbiome changes include decreased butyrate producing bacteria. As we discussed, that's one of the key short chain fatty acids. So that's absolutely key to our gut health and metabolism. And there was a study that shows insulin resistant mice with metabolic syndrome got fecal transplants from skinny donors, and they then had increased insulin sensitivity and increased butyrate producing bacteria. So it really seems like there's some kind of very important connection, again, between that short chain fatty acid and being able to, to be sensitive to insulin, respond to insulin. Okay. And hypertension, again, another component of metabolic syndrome. So animals with high blood pressure have been found to have dysbiosis, as mentioned before, an abnormal microbiome with decreased diversity and an increased firmicutes to bacteroidetes, which again, that's the flipped ratio. Short chain fatty acids also have an effect on blood pressure. So, for example, increased butyrate producing Odiribacter is associated with a lower blood pressure. So again, there's your short chain fatty acid butyrate, doing something very positive for your health. Okay. And this is a little bit of a busy slide, but I just liked how it showed, for example, there's the hamburger and the donuts and the hot dogs and all the hyperglycemic high fat diet. And you could just really sit on the slide for a while, but, just looking at the bottom is, what I think is important. Again, it all affects your gut microbes, and then it all is associated with the obesity, diabetes, metabolic syndrome pathway. So food is directly, related to this pathway. Okay, drives the pathway. Okay, so now we're going to get into what to do about it. So some actionable points, okay? So first of all, you can always change your diet, okay? So I find this extremely fascinating, right? So if you change your diet, your microbiome will change within days. And actually, even some studies say within a day, within 1 day. And this is also partly, when people travel and they're, again, and they change their diet and, you notice that your gut health is a little different. Maybe your motility is different, right? This is what's happening. You're changing your diet, your microbiome is changing, and it happens very quickly. And this study is extremely fascinating. So African Americans and rural Africans switched diets for 2 weeks, right? So African Americans then were eating a Western diet, right, which is high saturated fat animal products, low fiber, low plant fiber. And in Africa, they were eating a high fiber diet. They even say up to, people in Africa eat up to 50 grams of fiber a day. And these people have pretty much zero diverticulosis and colon cancer, right? But anyway, so what they did was they switched this diet, and then they found that African Americans who started eating the African diet, their butyrate just shot up. Like they changed their diet so drastically that they were able to change their short chain fatty acids and what the microbiome makes. So that butyrate just increased, skyrocketed so quickly. It's 2 weeks, that's it. Okay. And I'm just going to go through a couple different changes here. The red is kind of, not good for that gut-heart connection, and the green is very good for that gut-heart connection. So again, Western diet, like we talked about, you'll see the different columns there. So species or richness, diversity of the microbiome. So again, not a diverse microbiome. If you eat a Western diet, it'll show you there the specific microbes that are altered, the associated effects, right? Reduced short-chain fatty acids with Western diet, higher LPS. This is an endotoxin that's basically a structural component in the microbiome that's, again, going into the blood through a bad barrier, a broken barrier, inflammation, and there it is, decreased gut barrier associated with things like obesity, colon cancer, type 2 diabetes. And then you've got the Mediterranean diet on the flip side, right? Increased species richness and diversity, all of those different microbes that are altered. And then you have that increased short chain fatty acid, decreased inflammation, and decreased risk of cardiovascular disease and obesity. And here are 2 other kind of stark contrasts when you think about what you want to eat. Okay, well, protein is extremely important, but are you going to choose animal protein or plant protein, right? Animal protein increases TMAO, reduces short chain fatty acids, and increases amines and sulfides. And right now, actually, we know that sulfur is a very toxic gas and toxic metabolite to the gut and has been associated with inflammatory bowel disease and colon cancer, also their cardiovascular disease. And plant protein, again, it's exactly pretty much the opposite. Increases short chain fatty acids, right? Increases that gut barrier and reduces inflammation. And I thought this was funny. Do you like green eggs and ham? No, I like animals. Plus, I'm generally not a big fan of cancer and heart disease. Plus, they're green. What? is wrong with you? Okay, so again, when you're thinking about fats in your diet, right? The saturated fats are mostly from animal products. There can be saturated fats from things like coconut oil, right? So, people think, oh, I'm going to switch to coconut oil and coconut oil everything. But no, that's also not a good idea. There's a lot of saturated fat there. And again, you can have a lot of it's associated with inflammation, cardiovascular disease, obesity, diabetes, and then you've got the unsaturated fats, right? So that is exactly the opposite. And it actually has been shown to reduce white adipose tissue and inflammation. So again, like the omega-3 fatty acids, right? We always talk about kind of the shift and the difference between omega-3 and omega-6 fatty acids. And you really want to increase your omega-3 fatty acids. And you see that in fatty fish, walnuts, avocado, olive oil. And then finally, fiber gets its own slide because it is so important, right? And again, just short chain fatty acid, anti-inflammatory, anti-cancer activities, decreases risk, cardiovascular disease, obesity, diabetes, colon cancer. Dietary fiber comes from plants. It doesn't come from anywhere else. That's it. So as much of a plant-forward diet as you can. Okay. So we talked about certain specific kind of eating choices and patterns. Polyphenols, this is something less people have usually heard about, but these are real natural antioxidants from plants. And these are the specific ones here. Some things that people really enjoy, right? Dark chocolate, tea, wine, berries, a lot of good things there. And they're naturally occurring plant metabolites. So again, help fortify intestinal gut barrier. I will just have a side note there. Alcohol is not going to fortify your intestinal gut barrier, but everything else will. But in general, if people are choosing to have a drink, then wine would have a little bit more antioxidant capacity than some of the other alcohols out there. And again, butyrate producing bacteria and decreasing metabolic syndrome, inflammation, cardiovascular disease. And so, this brings us to the plant-based Mediterranean diet. We touched upon Mediterranean diet. Now I just talked about polyphenols that come from plants. I talked about fiber. Well, this is where we should be. This should be the pyramid that we all look to when we're really thinking about what we eat. And not just what we eat, but eating is part of your culture, your lifestyle, your social interactions. And that's really important. And that's why on the bottom of the pyramid is, being physically active, enjoying meals with other people. And then you have all of your fruits and vegetables, right? Fruits, vegetables, grains, whole grains, olive oil, beans, nuts, legumes, seeds, herbs, spices, right? So much flavor. You can't have a boring vegan diet if you're eating all of these things. Then there's fish and seafood. Again, you can get like a lot of omega-3s from that. Then after that, you're getting to your poultry, eggs, cheese, and yogurt. Again, poultry, white meat, so not as much TMAO, but be careful with all the eggs and cheese and yogurt. And on the bottom is red meat and sweets and sugar. And on the left you can see water. That's closer to the bottom of the pyramid. And then of course, in moderation, if you choose to drink, having a glass of red wine would probably be the better choice for your antioxidant capability. So again, it's not just, a good diet because it looks delicious to eat, but it actually has been shown to lower TMAO, right? Eating more vegetables reduces TMAO by reducing enzymes that convert the TMA to TMAO and remodeling the microbiome. So, vegetarians and vegans have a different gut microbiome, and vegans have a ton of this butyrate producing microbiota and less capacity to produce TMAO. So if you eat, red meat every day, you're going to be pumping out that TMAO. But if you eat a vegan diet for the whole week, and then you decide you want to have one piece of small steak, once every 2 weeks, well, you're going to make a lot less TMAO, because you have primed your microbiome to not, to have less enzymes to convert it to TMAO. So again, even if you say, okay, I can't cut out red meat from my diet forever, even if you mostly remove it for your diet, you can definitely feel better about having it every once in a while. Okay. And then this was a very famous study, again, primary prevention of cardiovascular disease with a Mediterranean diet supplemented with EVU, or extra virgin olive oil or nuts. And so again, you can see as the years increase from left to right, on the left, you have different endpoints like heart attack, stroke, death. And you can see there the different diets. The med diet, the EVU diet is on the bottom because you do not want a high incidence of those things. And the same thing on the right with total mortality. The med diet, you can see a very nice, clearly delineated line there, very much lower. Okay. And we didn't get too much into fatty liver, but I think, Dr. Janos and I have a ton of overlap with fatty liver. And fatty liver, again, is something that is just, it's like the hallmark. It's so embedded in metabolic disease. And we're just learning more and more about it. And, they've shown that if you give people with fatty liver a Mediterranean low carb diet, versus a low fat diet, which people used to think, oh, okay, well, if there's fat in your liver, just decrease fat. That's actually not the case. As you can see on the bottom, the cardiovascular risk was like dramatically decreased with that Mediterranean low carb diet and barely decreased with a low fat diet. So it's not the fat, that whole low fat phase or fad that was going on. I think it was the 90s. I can't remember. Everything was low fat. Well, that is not the right way to approach it. And especially not by cutting polyunsaturated fats. Okay. And this is just another interesting component of, for example, olive oil. It's found naturally. It's called DMB. That's found naturally in Mediterranean foods like EVU and red wine and balsamic vinegar. And it actually inhibits TMA formation to reduce TMAO. So again, perhaps maybe if you are having that occasional red meat, then, having it with like a salad with a lot of EVU and balsamic vinegar may be the way to go. Okay, so moving on to prebiotics. Prebiotics are fermentable carbohydrates that are not digested. You eat them, they go through basically your whole GI tract until the colon, where they get fermented by your microbiome, which means they get processed. And that's the process of feeding your microbiome. That's what they do. They eat this. That's the fermentation process, is eating it. And that makes them strong. It increases their diversity. And, what is it? It's, for example, pretty much all plants, honestly, are prebiotics, but specifically resistant starch. So plantains, green bananas, oats, barley, things like that. And you can also supplement with things like benefiber and inulin. And it's been shown to help glucose control, lipid profiles, like we talked about, especially triglycerides, inflammation, permeability of your gut, and weight loss. Okay. Probiotics. Okay. Don't think you can get away from talking about probiotics. Probiotics are everywhere. There's not one patient of mine who doesn't ask me about what probiotics should I take. And I always have the same answer, which is get your probiotics from your food. Probiotics are live microorganisms. You can find them in fermented and cultured food. So fermented food means it's the foods include sauerkraut, kimchi, miso, tempeh, and then cultured foods are things like yogurt. Or you can supplement, but I would just be careful. The evidence for specific, you have to know that it's a specific strain that's actually helping you with what your goal is, and the evidence is really not there yet. But Christiane Sanella protected mice for obesity in this study, and ruminococcus was associated with lower BMI and improved lipid profile. But I really do always recommend that before even thinking about supplementing probiotics, make sure you're getting fermented and cultured food in your diet every single day. Okay. So what's the future? So we talked about changing your diet. We talked about prebiotics, polyphenols, probiotics. Those are the 3 Ps that are so important for gut health. And by way of, the microbiome and the signaling, the heart and heart health. So what's the future? Possibly anti-TMAO drugs and, fecal transplant, like we discussed before in those studies, like actually taking the good stuff and giving it to somebody else and hopefully having them reap the benefits. Okay. Thank you. Dr. Janos, I don't think we can hear you.
Okay, finally I unmuted at least. Now not allowing to. Anyway, that was a wonderful talk. I'm really excited that everyone else got to appreciate what we've been talking about sort of for years.
Yes.
It's just so fascinating. And I'm always astounded myself when I understand it. Something that I also misunderstood, I think, in the 90s. I was part of that low-fat craze, thinking that as long as you reduced your fat, then you were eating healthy. In the meantime, you're really getting very often completely food that's completely devoid of any nutrients. Sometimes it's just low in fat, but it's also low in anything that's healthy or good for your body. So really a waste of time. And I think I'm fascinated by all the literature that you showed, showing that if you eat foods that are good for health and that improve your microbiome, you improve absolutely every single aspect of health practically. You've kind of covered almost all of them. Really, really amazing. So anybody with questions, please put them in the chat box. We'd be happy to answer your questions. So yeah, and then I think that a couple of questions from my standpoint are, so supplements, you sort of gave an overview of getting the nutrients from your food. Interestingly, this weekend I was at the American Heart Association meetings, and a trial came out looking at statins versus a number of supplements that a lot of people do tend to take for cholesterol lowering. And they looked at fish oil, cinnamon, garlic, turmeric, plant sterols, and red yeast rice extract. And none of them could lower cholesterol effectively compared to the statins and stuff. And I think an important message, number one, is, a lot of people just feel that taking supplements is a healthy thing. Like there can't be any harm. They must be good. They're over the counter. How can they possibly be bad for you? And these components sound like they're good. So what is your thoughts? Are there any supplements that you do suggest?
Sure. Yeah, no, I definitely agree with you, and see this all the time in people not wanting to take medication but taking drugs as if they weren't a medication, but they are. We know that they are. A medication is like active chemical compounds, right, that have an effect on your body. And it's interesting. I have patients who are definitely very interested in turmeric. There have been studies in specifically inflammatory bowel disease, ulcerative colitis, looking at curcumin in addition to some of our standard like mesalamine therapy, and it's shown to help in induction of remission as well as maintenance of remission. So to people who are really interested in using as kind of natural optimization in addition to dietary changes, because those are key, I talk about the literature and what's been found, but again with the caveat that of course everything can have a side effect. And I guess the key is with the medications, we know the side effects because they've been studied, and a lot of times with the other one in the supplements, we don't. And there was just a case series that came out on turmeric causing liver failure. And, unfortunately, this was also, I believe, 4 out of the 11 cases or whatever it was, also increased their black pepper with their turmeric, which increases absorption, which a lot of people are like, oh, well, that's very good. But actually, you could be, overdoing it, for your liver, and you don't even know it. So it's scary.
No, absolutely. And I think even if you are having, certain amounts of things, there is, such thing as hypervitaminosis. Like you cannot take an inordinate amounts of things, assuming that more is better. That is absolutely not true. And like you said, the liver is actually in a number of these things where they see issues because your liver can't really handle, I think, so many different things. But, really, really interesting. Are there any specific superfoods that you think people should absolutely be including in their diets?
So I think that all of the fermented and cultured foods should be, people should have as a staple on a daily basis. And, I think, something like sauerkraut is a superfood. It's cabbage. So there's your fiber. It's a prebiotic and it's fermented to have probiotic live cultures in it. So I think, you can't go wrong with all of our natural probiotic foods that we have. Obviously, if you're choosing to do something like yogurt, without added sugar, and I do prefer the plant-based types like coconut, soy, almond, a lot of different varieties. As far as other superfoods, so when we talk about prebiotics, they're, natural sources of prebiotics that are also really, really great, like psyllium husk, right? So the psyllium husk is the all famous Metamucil, but Metamucil is orange and full of sugar, right? But if you talk to your doctor and you think that you decide that it's a smart idea to increase fiber, which I think it is for most people, you just have to do it smartly. That's why I said talk to your doctor, because fiber can bind medications. Like you said, if someone's taking a statin or any important medication, you take it with fiber, it'll bind it and prevent its absorption. And people can get bloated from extra fiber and things like that. So I think, the superfoods are really, natural plant-based sources of pre and probiotic foods. But always, try to do it safely, even if it's food.
Exactly. Excellent advice. There's a question related to that they're asking, aside from the probiotics, when we know that the gut, there are specific bacteria that are beneficial, is there a way that you can sort of ingest the beneficial gut bacteria? And my assumption is that, it's just never going to make it there, like just because of the acid in the stomach and variety of things. But is there a way to eat the bacteria that'll then get to your gut and sort of take over?
Yeah, I mean, I guess the only real options right now, right, are, again, eating probiotics. So actually dropping in the little capsules, which, like you said, are resistant to your extremely acidic stomach environment and your, pancreatic enzymes and all those things that are in your stomach that, do have the, the capability of destroying some of these live bugs. But another interesting, thing to comment on are postbiotics. And, because a lot of people tell me, well, how am I going to eat miso soup? How is that going to be beneficial? Because it's hot. And so doesn't the heat kill the fermented organisms? So there's actually been multiple studies showing that even the organisms that are deceased have beneficial effects. So that's why, like, again, it makes sense, right? Very hot miso soup, clearly the organisms are not alive anymore, but they still have a beneficial effect. So same thing, again, if, you maybe wonder, like, okay, what about in yogurt if you're eating the live cultures? Well, same thing. There's the postbiotic effect. And also there's, when you have the vehicle of food, it's always absorbed differently. So I think, again, we're going to be getting it from food, pills, fecal transplant. I don't think there's any other kind of way that I can imagine so far.
Got it. And you just led into the other question, which says, can you elaborate on fecal transplant? How is it done and how is it currently used clinically?
Sure. So there is only one indication for fecal transplant in a non-research setting, and that is C. diff. That's the only reason right now. So C. diff is a super infection, if you will. For example, most commonly, if someone takes antibiotics, it clears your, good bacteria, so it can't fight and keep the C. diff at bay. The C. diff creates a colitis inflammation of the colon that can be extremely dangerous, put you in the hospital. And for people who fail antibiotics to treat it, and there are multiple antibiotics, or they're just doing a lot worse, then we actually deliver, and I've done this before at Lenox Hill, we do this. We do fecal transplants via colonoscopy. So we literally just have, a little spray catheter through our colonoscopy. We just spray that new microbiome throughout the colon. It's great, and people really have drastic recoveries from that infection. Everything else is in a research setting. There are different ways to do fecal transplants. People do them as pills. That's kind of probably the trend now, has changed from doing it through colonoscopy to doing it as in some kind of a pill form that, again, is stable to deliver most of the fecal material as low as possible.
Got it. No, that's great. Excellent. I think there's one other question that this brings up a lot of questions in one of our participants' own life about poor diet, metabolic syndrome, PCOS, and really intense IBS disorders in youth.
Yeah.
Plus related to heart attack. Really, I think you tied in every aspect, and it's fascinating to me. Like, I still agree with you with how your gut, if you're a pure vegetarian and you have a very healthy microbiome and you just were introduced to a little bit of animal product, your gut microbiome is healthy, so you do not produce as much of that negative toxin by not converting it. It's just fascinating that it really does depend on what your gut is really composed of, what your health or not healthy outcomes may actually be. It's incredible. One question for you, because you do a whole other, and you can comment on that as well if you have anything to say.
I agree with what you're saying. And I think, we're learning more and more. So, for example, PCOS has also been shown in studies to have certain microbiome changes. And we know that PCOS has to do with high testosterone and high androgen condition, as well as insulin resistance, right? And so again, and we've talked about how combined or how connected that is to the microbiome. So I think Hippocrates was right when he said all disease begins in the gut. I think we're going to learn more and more as we progress in research that there's some gut component to everything.
Exactly. So just a last thing to end on, just because you have this whole other title, and we talked all about heart and gut connection, but just the mind, because you are the neurointegrative director of gastroenterology. So any comments there, and anything that people should keep in mind, and just like our last, comments to the audience?
Yes. So I think that something that is really important is the gut-brain connection. So we talked, like you said, about the gut-heart, and there's a gut-lung connection. There are all sorts of connections that have been studied, but the gut-brain connection is really key, and the autonomic nervous system is a big part of it, and that actually, again, ties in the heart and specifically heart rate. And heart rate variability. And it's something that I'm very interested in, because you can use certain parameters like heart rate variability, and, people are using wearables, for example, and checking, different parameters like their steps and their heart rate, things like that. And so people can actually look at their heart rate and use it as a function of their, for example, parasympathetic nervous system, which is your rest and digest. And that's what you want to access to have good digestive health. And so I think this is kind of the new frontier, which again is fascinating because it combines really, cardiology and, neurology and gastroenterology. All of them, they're really so interconnected, and I think it's going to be exciting to see, where that goes.
Yeah, no, that's wonderful. I think we've all experienced the effects of stress on sort of your stomach and upset or various things. So it's intuitive to us that this connection exists. And the more we can do to understand the connections and potentially impact them, I think the better. And a lot of that could be through healthy lifestyle, and a lot of what you're promoting as well. So thank you very much for joining us today. Thank you everyone for joining our Building Bridges lecture series. And we will be back next month with another hot topic. Thank you, Dr. Ivanina.
Thank you. Thanks for having me. Bye.
Bye-bye.